It's good to have you on here this afternoon. How are you doing today?
Hey, great, Eric. You hadn't been around for what, 2 or 3 weeks, I think.
Well, I was just out last week, but I think the weeks before that you were actually doing some of the interviews there. How did those interviews go with some of those licensees there?
Oh, they went fantastic. I had one with, a lady who's been with us for some time now, Beverly Ryder, and she's just built her business so big. She billed $25,000 last month to one client.
Wow,
So
just one client.
she's doing fine. Yeah, so you think I haven't been around since black and white days, huh? So I guess I'll just
I thought I'd throw that in there. That's a good way to put that in there.
I just walked in the room when I heard you talking about that. Yeah, that was a while back. Hey, this is going to be a great webinar, Eric, because I think the people who are on here who have not been on here will find out that we get down to the nitty-gritty here. We're going to tell you the exact 5 ways that you can build a very profitable healthcare business of your own, and it's very, very simple to do that. And while we're talking about it, Eric, you want to tell them about the little question box there?
Absolutely. Folks, this webinar, let's make it about you, not necessarily make it about Patrick and me. We want to have a communication and dialogue with you, so feel free to ask us any questions as we go along. If there's a specific topic you want us to be able to talk more specifically about, we'll certainly be able to do that throughout the next about 45, 50 minutes here. And so feel free just to, at any time, jump in there with a question, and we'll see. But remember, to ask us a question, you have to type it in there. So feel free to go ahead and do that. Well, Patrick, let's go ahead and get started here. Let's talk about these 5 ways. I know that you and I have kind of narrowed it down. A lot of this, some of it, kind of given the peek behind the curtain here, a lot of this is actually some of the things that we actually teach during the training class.
Yeah, and let me point out, folks, that we just picked these 5 because on other webinars we've covered some other methods. We teach about a dozen different ways to go out and actually build your business. So if you're thinking about getting into the medical billing business, we're going to give you some ways that we teach our licensees. Now, we're not going to go into the depth that we do in our week-long training workshop. We probably spend an hour and a half on each one of these, and we go into in-depth. But we're going to give you kind of, like Eric said, a peek behind the curtains, just to give you a hint as to what we know about this business after doing this for 22 years.
Yeah, the first one is just how to start getting referrals. I think the best way that anybody knows about, it's always better for someone to get a referral from someone basically to a doctor. That breaks down that fear of trying to have to quote unquote go cold call doctors and not do any kind of things like that. So we're really going to kind of reveal a few of the things that Patrick, I mean, these are one of the sections that I think you actually teach during the training class.
Yeah, and Eric, this is so important that people realize that the big fear people have is, well, how am I going to go out and convince a doctor to turn their billing over to me when, I just started my business, I don't have any clients of my own. Folks, getting referrals, teaching you how to connect with people in your community that can give you referrals to doctors is one of the secrets that we're sharing with you here today. That is, you don't have to know anything about this business. You don't have to have clients if you get a referral from somebody else. And we're going to show you how to do that through professionals and others that are out there.
Yeah, then we're going to talk to you about how to learn to be the expert with educational events. And I know that, Patrick, I think one of the greatest takeaways that a lot of our brand new licensees get from the training class is that they do really feel like they're the expert now in a lot of areas. And even though they don't know everything, the expert of being that medical revenue manager, that's kind of sets everybody apart.
You bet. And we're going to go into depth on that one. That's a good one to position yourself as the expert when you really you don't know a whole lot at first.
Of course. And then rubbing elbows with doctors at trade shows. As you know, I helped one of our licensees just about a month and a half ago with that. That was just a wonderful experience with him, and a great way to get, boy, you talk about get the leads in, if you want to call them that, with doctors.
A bunch of people all at one time without you having to go out and make calls individually on anybody. They're all coming to you at a trade show. Yeah.
Yeah. getting everybody's greatest fear, getting past that gatekeeper, and how to make that gatekeeper your best friend. That's one of the things we're going to show. And then, hey, I don't think a lot of people do this. What about just using sales reps, Patrick?
Yeah, I mean, I tell people, look, if you don't have the time or the personality or the inclination to do any kind of marketing on your own, there are people who do love to sell. And we're going to show you how to find those people and hire them and train them and get them out there bringing you all the business you can handle.
Yep. So hopefully one of these topics here is going to help you as you're trying to make your decision whether you want to move forward with us. So let's just get into the first part of it. Let's talk about this whole screen here. We talk about you cannot sell. What does this mean, Patrick?
Well, it means that people don't want you to come into their office trying to sell them anything, whether it's politics, magazines, candy, or religion. So I found this sign. I thought this was hilarious. But there are people out there that actually have no soliciting signs on there. We're going to show you folks that you don't have to be a, quote, salesperson to market these services to doctors. Why? Because it's like if you had popsicles and you were in the middle of the Sahara Desert, would you have to do any selling? No, I think people would take those from you, right? That's what we have. We have more money, more cash flow, more revenue for the doctor's office through your services, and there's nothing to sell about more money, bringing more money in. We're going to show you how to do that the right way. In fact, Eric, as you know, during that training, I tell people who've got a background in sales, forget everything you know. It won't work in this industry.
Yeah, and this is what's going to happen if you kind of approach a doctor as a quote unquote salesperson, because they're just going to say, I just don't have any time for you. But I think the better way, again, as we're talking about this, is we're going to show you and position you how basically, without trying to read this word for word, we're going to show you how to be more of a resource for doctors than a salesperson trying to sell the doctor something that they don't feel like they don't need at this point.
Yeah, you're going to position yourself as having things that the doctor needs, information, content, we call it, educational materials that gets the doctor interested in reading and knowing more about you and your company and hopefully your services.
Yeah, there you go. All right, so let's talk about what getting clients is all based upon. These are some of the basic, Patrick. And you do go through this in the training class, but let's talk about what it means of this whole thing about relationships.
It's all about relationships, Eric. In other words, doctors want to do business with people that they know, like, and trust. We're going to show you how to build that relationship with doctors and with other people in your community so that you can connect with the doctors. People love to do business if they think there's a relationship there between you and maybe somebody else. So we kind of go back to that referrals thing that we mentioned earlier. I'm going to teach you how to build that relationship through other people's. They've already got the trust of the doctor, and so they're going to just introduce you to the doctor that way.
I always ask people, a lot of people do, obviously I talk to several people at times, and they say, I'm just afraid of selling, or I don't think I'm a good marketer. I just simply ask, do you have fear of building relationships with people? And I think once we kind of break through that area, you start to see what we're talking about here. And you already brought that up about the whole thing about trust, that, it truly is about trust, because, I don't mind doing business with somebody that I can build a relationship with. And then obviously it can be certainly about the money, and that's good for the doctor.
Yeah, if nothing else. Even if they don't think they have a real relationship with you yet, really have full trust, if you show them bottom line, Eric, that you can bring them another $40, $50, $60, $80, $100,000 a year in revenue, all of a sudden people want to do business with you. That's how you get a client, is bottom line is the bottom line, right? So as a doctor, as the business owner of his practice, if you can show him or her the bottom line is I'm going to bring you this much more money in, then there's no reason why they wouldn't give you a try, at least. And believe me, they're desperate right now because they're struggling to see more patients because of the Affordable Care Act and all these new codes that have come out and new regulations. They're being audited. They have a lot of things going on in their practice. They'd rather focus on their practice and helping patients get well.
That's right. And one of the ways that we build relationships and trust, and it's built around the money, is we'll show you how to do that through a practice analysis. And folks, the practice analysis does that with the relationship. It builds the trust, and like Patrick said, it can show them how much money that they may be losing on a monthly basis, and what you can do to help them with that. Patrick, I think we've found out that networking is really become the #1 method for licensees getting their first client. And everybody's asking, how do I get my first client? I think if we could just spend the rest of this webinar together showing that and kind of helping that sink in, I think that's just the way that it works there the best.
Yeah, that's why about 6 or 7 years ago, Eric, I started, as you know, a networking group here in the Dallas-Fort Worth area because I wanted to know exactly how to do it the right way. There's a lot of people out there networking, they call it,
right,
who are really just out there trying to sell their products and services to other people in big groups of people. But there is a right way to do this networking thing. One of the ways we teach, of course, is to go to some of the chambers of commerces that are all over the United States. In every city, there are sometimes several chambers of commerces. And so, folks, this is a very important part of your community, and we can teach you how to plug in and become a part of those organizations and become the trusted advisor that people are looking for in business by being an ambassador, for example, for your local Chamber of Commerce. Some of these you can join for a fee, a monthly, an annual fee. Some of them you just join just to be a part of the organization. And then there's the other commercial, I call them commercial, like my group was, where you pay a membership fee each year to be a part of that group. And there's all kinds of stuff out there, folks. In the Dallas-Fort Worth area, at one time, Eric, I looked around here, and there were like 63 business networking groups meeting each week here in this area. So people just don't realize how many groups there are out there. If you're not a part of them, of course, you wouldn't be aware of those. But we'll show you how to find these groups, how to become a part of them, and how to be an integral, needed member of those groups so that the people in those groups want to share referrals with you.
Yeah, because these are these places where you're not really trying to sell those that are in your group anything. What it becomes is that they're there for the same reasons that you're there. They're trying to meet other people that have similar clientele that they can share with one another. Obviously, some of the best ones that can be are CPAs and attorneys and bankers. Those are, if you can build a relationship with some of those folks, that's just wonderful.
Yeah, and we have all kinds of methods of doing that, by the way, and letters that we've pre-written and all kinds of marketing materials. Again, we don't have the time in this 1-hour webinar to cover all that we cover. Eric, we probably spend an entire day, one full day, or maybe a little more than a day, just on the marketing, because that is a very important part. I know it's the scariest part, right, for most people starting any business is, what if I get into this business and never get a client? Well, folks, with our system that we've got worked out, the only way you could not do that is just to not do anything. Again, with a dozen different ways, something's going to appeal to you, your personality, your time, your budget. You'll be able to figure this out. We're just showing you a few ways here on the webinar that we teach how to do that, but we go in real detail about these things. Eric, I had a guy one time at a networking group try to sell me some magic liquid vitamin mineral potion of some kind, and so he was just trying to sell his product there at the meetings. That's not what those meetings are all about, and we'll teach you how to do it the right way.
Yeah, and so why don't you explain a little bit more what Power Partners are all about, because I think that's the end goal at one of these networking meetings.
Yeah, we call them Power Partners because really those are people who market to the same market that you're marketing to, doctors in this case, but they're not competitors. Obviously, you wouldn't partner with another medical billing company. You'll find it rare that even medical billing companies even are a part of these groups because they don't know that this is one of the secrets of getting their business started really, really fast in the community. But we teach you how to find other partners, like Eric was mentioning earlier, bankers and CPAs and even real estate agents. There are all kinds of people that market directly to doctors, financial advisors. So we're going to teach you how to plug in and market with them. By the way, you mentioned Dr. Vicki Rackner earlier. She's one of the members of our advisory board, as you know, and works with our licensees and teaches them how to connect with doctors. She was in private practice herself for over 20 years as a general surgeon, and so she knows what it takes to get past the gatekeeper, to engage with a doctor, and we share all of her secrets through our webinars as well.
Patrick, there's a question that did come in specifically on networking. This is from Diane. She goes, has anyone had experience with the National Association for Professional Women? Do you know anything about that group there, Patrick?
I did know of one licensee who, a woman who was a member of that, and she said it was a wonderful group to get involved with. So yes, there are groups specifically for women. There are specific groups for certain nationalities. So in different areas of the country, you just have to look for those different groups. Google it, put in some keywords, and you'll find that there's some, always just add business networking group. So
right.
Maybe it's an Asian business networking group, an Indian, Hispanic, Black. There are all kinds of groups out there that are specific, and this women's group is a real good one. Yeah.
Absolutely. All right, let's talk about this second one. We've kind of worked that whole networking channel there, and again, folks, that is the number one way most of our licensees do get doctors. Now we're going to kind of branch off into another area that we actually teach in the training class, and that is to become that expert through educational events. And you know what we talk about is that we position you as the subject matter expert. Go in a little bit more detail about that, Patrick, what that means.
Yeah, so everybody wants to do business with somebody who's an expert, right? If you are looking at investing, you want to get with a broker that you think knows what they're doing, right? You don't want to invest with your brother-in-law, even though he might have just started, selling stocks and bonds. What you want is the expert in any field. When I have a handyman that comes to my house, I want somebody who's an expert in fixing toilets or plumbing or whatever the thing is that I'm looking for. We're going to teach you how to position yourself as that subject matter expert. In this case, the subject matter is the healthcare field. We'll teach you enough in this one-week workshop that we do down here in Dallas to go out and get started. But we're going to teach you also how to plug in to our existing network of licensees. So you may not know everything there is to know, but believe me, we as a group know everything there is to know about this industry.
Yeah, one of the ways is what's been termed as what's called a lunch and learn. And folks, all this is just it's a brief little presentation that you might be able to make. Or, as you can see here, I'll kind of even circle that around right over here. Let me see if I can pull that back over to here without having that presentation pull up. Let's see. I talked about having a power partner there. So what you can do, obviously, is be able to go right over there and have you and or your power partner do these lunch and learns.
Yeah, you're just gathered around with the office manager or the doctors at a lunch. Usually you bring in some food for them, right, and feed them a lunch. Might cost you $50 to feed the whole group. And you've got their captured attention there for 15, 20 minutes. Sometimes you might want to show it on a laptop like is illustrated here. We have several PowerPoints already designed and ready for your use to present these topics on HIPAA compliancy, Medicare audits, all kinds of different topics that we've got already worked out for you, and we'll teach you how to do those. In fact, we do a little exercise in the training class, Eric, where it walks them through that.
Right. Now let's see what else we got here on this whole subject here. Let's see if I can make sure I got my there we go. And so again, that whole thing that Patrick was saying, we've got PowerPoints for those that are really sophisticated, those that want to use their Apples or their Keynotes or whatever else. We do have that can be converted into Keynotes there as well too. So we're going to help position you, even though that you may have to stand up in front of a group of people, and or if it's not you, it could be your power partner that you've been working with too as well.
Yeah, we know a lot of people are not comfortable getting up in front of a crowd like you see illustrated here. But folks, again, that's why we're going to teach you how to find those power partners that you're working with, who some of those folks just love to get up in front of a crowd and present. You're going to give them the content, go over that with them, and have them do the actual presentation. And then at the end, of course, you're at the back of the room, meeting people, giving out your literature, and making the connections that you need. So again, positioning you as the person that people should go to if they're wanting to find out more. We'll show you how to do these seminars at hospitals, for example, at nursing homes. There's all sorts of places that will open their doors that love to have people come in and make presentations to doctors and their staff.
And these could be done at really any time. It could be for those that are thinking about doing this as a part-time business. We've known some people, Patrick, do like a small little short breakfast where they bring in a little bit of breakfast. They do it during that time. Obviously, you can do it during a lunchtime or even after hours. So if you need to do something at any of those times, you know, you're trying to work this part-time and you want to try to get to as many people at one time. You think of it, breakfast, lunch, or dinner. You could actually be in front of a group of people there. So that's a good way to kind of be thinking about it.
The lady I interviewed a couple of weeks ago said that very thing, that one of the ways she got one of her first clients was from the educational event that she held that people came to. She sent out letters, people come to it, and she got her first client from that. Folks, if you just get one client every 2 or 3 of those that you do, it's well worth it, because one client in this industry can earn you $30,000 to $35,000 a year.
Absolutely. And as Patrick's been saying, how do we position you as that expert? Well, again, the live training workshop that we've got one coming up here in September, we're actually going to certify you as a certified medical revenue manager. As you can tell, it's more than just the medical billing. Folks, we really focus in on the doctor's money. We've got to know that doctors have been hit by all sorts of different ways, you know, medical billing platforms and EMRs and all that kind of stuff like that. We try to help you focus strictly on that medical revenue. So that's why we certify you as a medical revenue manager.
Eric, I'm so disappointed. I'm waiting for questions in the question box. I feel like the Maytag service guy. And I'm just sitting here looking, and nobody's typing in questions. I don't think they really think this is live. You think that's it? Maybe that's it.
It must not be. I think hopefully we're answering a lot of questions here. So, all right, let's move to the trade shows, and don't let this one scare you too terribly much. Most of the trade shows that a lot of the licensees do are on the smaller scale, but folks, I think we've all been to trade shows. You know what they are, you know what they look like, and we've got a great trade show booth that we're about to show you here. So let me get on over to that. I think here's one of them. Here's just one that has been recently done. Patrick, why don't you talk a little bit about this particular trade show booth that we've got right here?
Yeah, this is the tabletop. Now, we have a full-size one we'll show you here in just a moment, but this fits on a table, as you can see. This looks like she's doing this one maybe even at a Chamber of Commerce meeting or some other smaller event. But folks, these are the kinds of things that make it easy to market our services, because you're just standing there. People at that event come up to your booth, and you engage with those people, and you capture their information, of course, on a registration card of some kind. Maybe you're giving away a free prize or something like that, and you're following up on these leads. This is where the real business comes in at these things, is the follow-up that you do after the event. I've had many licensees, though, Eric, tell me that at the event they had a doctor set up an appointment for a practice analysis or for a free live demo. That happens all the time.
Yeah.
This is the one that you're at down in South Texas.
That's correct. I helped this particular licensee get that booth set up. They have a little big booth right there. You see all of that? Yeah.
Can you kind of point to that one? He's actually two guys talking there, and that is our full-size booth. It's like about 10 foot wide, and it sits there, and you put a table in front of it usually, and yeah, that's it. He's circling the actual booth back there that you can see right there. So, folks, we basically just let you borrow these. We spent thousands of dollars developing these trade show booths, and you can just borrow it. You just pay the shipping. That's all you pay. So it's a great way for you to stand there, engage with doctors. Doctors go to all kinds of trade shows, by the way. It doesn't have to be a medical trade show of some kind. We held one, Eric, as you know, a few years back over here, just trying to find actual licensees in Dallas, and it was a women's expo.
Right.
But during that 2 days, 5 doctors stopped at our booth and asked if we did medical billing. And as you know, as a company, we don't actually do medical billing. We teach and train people how to do it. But the point is, there are doctors that go to all kinds of things. I'm sure they're in auto shows and home and garden shows. They're everywhere. So great way to contact people.
Well, I can't. I have to stress here. I mean, this licensee that's right here, I know specifically this gentleman right here is a doctor. You can see they're completely engaged. The doctor's asking questions about what's going on. So even though that this one has to do with more of like what people would know as a foot doctor convention or whatever this might be, folks, this is what this is all about. I mean, just setting up this, that's why we have this. I mean, as you can see here, this is how you can obtain a lot of leads. You build your credibility, you schedule your practice analysis or even set demos, but again, more importantly, that thing that we talked about early on is how you just develop relationships, and that's the way to be able to do it. All right, so let's get to this. Oh, go ahead.
I talked to Tim the other day, by the way. The licensee's name in that picture is Tim. And I talked to him the other day, and Eric, he said he's got at least one client from this, and maybe two. So
good.
Well worth his time to go down there. Yeah.
Well worth his time. All right, let's talk about that dreaded person called that gatekeeper, that lady that's behind that bulletproof glass there. That always seems to be the scariest person to talk to.
Yeah, a lot of people are afraid, that how am I going to get past this person? Because they know that person who's the office manager usually is the person who's probably overseeing the billing if the doctor's doing the billing in-house, right? Have his own staff doing it. That person, that's her job. So are we taking away her job? Well, folks, what we do is we teach you to become that gatekeeper's best friend. We're going to educate her first by giving her some educational materials. We have books. Eric showed you a couple of them earlier. There's another one on this screen called How Physicians Can Get More Patients. We're going to book to that office manager, that gatekeeper, and make her the hero in the office, bringing to the doctor the fact that we can outsource this billing and bring in more revenue for you and free my time up so that I can help you see more patients. That's where the money's made in a doctor's office, seeing the patients. So we're going to help that gatekeeper, that office manager, help the doctor see even more patients and take the burden of the billing off of her.
Yeah, and let's talk about this real quickly because Nick's got a great question here, and it all has to do with the marketing, the books, what somebody might need to spend. And Nick's asking after the initial cost of operating the business, about how much money is the most I'll have to spend before I get my first client. Patrick, you want to kind of address that because that could be. You could spend a lot of money, or you could just use the things that you get here through the business package.
I tell people, look, you spend what you need to spend, of course, to get that first client. But in many cases, we have methods of marketing that doesn't really cost you any money. Now, they're going to cost you time. So in marketing, you're going to spend one or the other, sometimes both, right? Time, money. And so we just tell people, if you have more time than you do money, we'll teach you how to do the things that can get your clients by just spending time. But if you're going to spend some money on maybe direct mail, for example, that's one of the methods we teach, then you are going to spend some money, of course, for the lists, the books, the envelopes that you're going to send them out in. And by the way, this is one way we get past the gatekeeper if we need to. We can get this right to the doctor's desk, that book, or that piece of educational information along with your letter by using special envelopes like this. So we go into depth in that in our direct mail. But the point is, Nick, that you can spend whatever you want to. I've had people tell me that they got all the flyers that we send as a part of your business package, and that's all they needed to get their first client. Others, because they were working part-time, had to send out more over a longer period of time, and so they had to spend a few dollars to get some more flyers printed up. Same way with the books. If you want to buy these books and give those out to doctors, those are going to cost you some money as well. So, right. Nick, you couldn't spend, in general, I tell people, you could not spend more than $500 to $1,000 in all your marketing efforts to get your first client. It doesn't mean that you couldn't, literally, but I'm saying in general, that's all you would need to allocate for marketing expenses.
And one of the simplest things here, this is just such a unique way to, again, kind of become friends with the gatekeeper. It's kind of a tongue-in-cheek type thing here, but we're going to show you how to order these medicine bottles. We already have a template there, as you can see there, for labels that go straight on there. And you can fill these things up with jelly beans or M&Ms or whatever else. And as you're just doing some of your direct contact, just there to pick up drop off a book and maybe eat some candy. I mean, Patrick, I mean, my goodness, who doesn't like candy? Everybody likes a little bit.
It's amazing how food will just open the doors for you. You know, I mentioned earlier that you could have a lunch and learn and bring in lunch. That's one way to do it. Donuts in the morning is another way to get everybody's attention. Hot, fresh, piping hot, iced donuts. I'm
you're on a diet.
I'm kind of on a low-carb diet right now, so I'm thinking about donuts, yeah. But yes, we teach not just this method, but there's several other methods of making that that office manager, that gatekeeper, your friend. Okay, Eric, we probably need to move on to the next one, which is, of course,
let's talk about sales reps. Yeah, I mean, this is a great topic to talk about. Obviously, this is number 4 in our list here for the 5 steps that we're talking about here. Kind of about spreading the net or throwing the net wide by utilizing sales reps. Folks, you can hire sales reps. And I know the first question is Patrick, how much is this going to cost me? You want to answer that before we get into this, so we just take that question right off the top?
Well, sales reps is one of those things that, you know, you could spend some money on it. Let's say, for example, you hire them and you're going to provide them maybe some marketing literature, maybe even their business cards. What, you can get business cards nowadays for, what, 10, 15 bucks. It's not a big expense, and you might have that person cover some of those expenses or at least provide it up front and then take it out of their commissions. But folks, you're not really out any money for the sales themselves because, as I mentioned, you're paying these people a straight commission. That means they bring in the business, they've gotten a setup fee from the doctor's office, you'll give them a part of that, and you might even give them a part of the billing for the first few months on the back end to help them build up a residual income of their own. So you don't have to be out of a whole lot of money for this at all.
Right. So we're going to go in much more depth of that during the training workshop, but here's just a great example of you can be in one part of the country and your sales rep can be in a completely different part of the country. Yes, you don't have to have a sales rep in your area. You can have them clear across the country. That you have the territory that you see here is the United States.
Yeah, I've interviewed licensees who will tell you during the recorded interviews. You can watch some of these on our website, by the way. It's under the News tab under Blog. And you can go watch some of these interviews, folks, and see how people have utilized sales reps to go get them all the business they need. In fact, one guy told me, Eric, that he had to stop his sales rep and say, don't bring me any more business because they had built it up so big, so fast, that he really couldn't handle the new clients that this guy was bringing. So we're going to show you that's why you help them build up a residual income on the back end as well for themselves. They're building their own business basically within your business. Right. And because we don't have any territories, this guy had advertised for sales reps in all. I will show you how to find these guys, but they're everywhere out there, guys. And he had them all over the country. I mean, literally from coast to coast.
That's what Jack was just asking. How do you find these types of sales reps? And that's what we're going to show you in that training sales workshop is specifically how you do it, where to find them, what ads you need to run in certain either on websites or the locales of what to be able to do. Sales reps are looking for new ways to put new tricks in their bag, so to say. So, you know, we're going to show you exactly how to be able to find those. Let's talk about a few of the advantages that will help them with someone that's brand new getting involved in this business.
Yeah, and a lot of times, by the way, they don't have to be full-time. There are sales reps selling things to doctors that can add on other services and products to what they're selling to doctors. You know, there's folks selling, you know, rubber gloves and cotton balls and equipment and all kinds of things to doctors. So sometimes just finding a guy who is already plugged into the medical network and community in your community, all of a sudden you've tapped into that person and shown them how to add extra revenue to what they're doing by just mentioning the fact, you know, when they oversee something about the billing in the office, they can introduce your services to that doctor's office, and bring you business without having to do much more than just making the introduction.
Right. So what you can have as your advantage, I mean, you can have several different people working at the same time. That's one of the great ways of especially if you're going to do this part-time as you're trying to get your business up and going. Obviously, it's just a great way to kickstart your marketing and grow outside of your own area. That's the biggest other area that you can expand. So as you start to talk to other doctors, you can say, well, I've got not only doctors here, but I've got some in another state. So it can kind of show you that it gives you a great advantage of what you do and how you actually end up growing your particular business. I know that some of the questions that are coming up already, we'll talk with you about this, but 19, you're asking about how do the commissions work. What you're going to learn all of that during the training workshop. Obviously, you're going to have how to find, how to interview, how to hire, how to train, and yes, how to pay each of these sales reps and knowing what to do. So that's very specific about what we do during the live training workshop. Patrick, you want to add any more to this whole part about the sales reps here?
We probably spend at least a half hour just talking about how you pay sales reps, because there's a lot of different ways you could do it. And I mentioned earlier, for example, that you get a setup fee from the doctor when you set them up. That's a part of the way we present this. And so as a part of that setup fee, you're going to share some of that with the sales rep. And then you give them a percentage of what you're actually getting paid from the doctor. And again, that depends on the doctor. It depends on the volume that they have, what percentage you're charging that doctor as a billing company, and so what you're going to give that sales rep. So we can't go into real depth here, but the point is, folks, you can't stumble over the pennies on the way to the dollars. I would give a sales rep all day long a nice chunk of business for giving me business that I wouldn't have had otherwise. Does that make sense?
Mm-hmm.
Yeah. So we'll go into detail. Again, Eric says we can't cover everything in this 1 hour here, but that's just a hint, and that's why we encourage people to do your due diligence, find out if we're for real, ask your business coach if you can talk to some of the licensees that are out there that have actually built their business and are successful. And that's the best way to find out more about this business and decide to come on down here. Folks, if you just come on down, I tell people, that's why we've got a money-back guarantee we're going to talk about here in a moment. Do that because I want you to see what we have, and if it's just not right for you, we'll give all your money back to you. Just that simple.
Yeah, and before we get off in the sales rep part of it here, Patrick, Jim's asking a great question. Does the sales reps or the people you hire to do the actual billing need a certification or require training of past anything that we provide them? I think this is a great opportunity. If you've got a moment here, I think we've got a little bit of time here for me to do this. I'm going to jump out while you can answer that question, and I'm going to jump out actually to our licensee support site, kind of show some of the things behind the scenes there.
Sure. You know, guys, we've put a lot of time and money into this sales rep training program because we want you to have all the tools you need to go out and find these people, because as you get clients, we as a company make money on the back end as the transactions go through our system, so we want you to get as many clients as possible. And that's why we've put a lot of time and money in developing a training session for your sales reps. So we're not just training you, we've got videos and things that your sales reps can watch that will train them without revealing anything about your costs and the behind the scenes that they don't need to know about. So we've got all that worked out, and Eric's going to show us here a little glimpse of our licensee support site. This is it live. He's actually logged into it here on the internet, and as you can see, he's just kind of showing you some of the things that are behind some of the menus there. We have a whole section on getting started. Look at all the services. Every one of our services is covered in detail. We've got marketing, all kinds of marketing things there. And yes, there's a whole section there on sales reps. So as you can see, we have videos on here that train you on how to find and hire and get the sales reps up to speed. Then we have videos that are for your sales reps, and we have secret passwords for them and so forth. Again, that doesn't reveal anything about us as a company. It's just for training your people that work for you.
Yeah, Patrick, I thought we'll just go ahead and show a few of these things here, but you can see how we've got trade shows and how to do that. There's that candy pill bottle label that's right there that you can print out, and what Avery website and template to use, and where to find the pill bottles and everything. So I think
I've had people come through our training, Eric, that have bought maybe another franchise in the past, and they've told us that the franchise that they spent $300,000 on didn't have this type of support material on a website like this. Folks, we've got 100+ hours of training just for you right here on this private website that you'll have access to as an ABS licensee. Show them the news tab there, Eric. I just want people to see that we post things on here on a regular basis. There's something we posted just yesterday. Then there's one for the 9th that we posted there, a proposal review. A sample newsletter layout guide was a couple of days before that. I mean, folks, it's just a constant. Well, you can see from the archive on the right-hand side there, this goes back to September, I think it said, of 2014. That's when we started posting stuff on here. So there's dozens and dozens and dozens of ideas and new marketing tips. Folks, this is a part of you as being a licensee. There's never any cost for access to this site. It's wide open to all of our licensees. In fact, Eric, as you know, we used to have like a 2-year support thing for licensees. I changed that to lifetime support, and now even our old licensees that signed up 10, 15 years ago, they have access to all this as well. Because, again, we want people to be successful, so we're going to give them all the tools that we possibly can to be successful.
So